think for me is just because where where my practice is, I'm treating mostly farmers and criminals. No, I'm joking. But they're mostly kind of an older crowd. So a lot of the time it's kind of 60 and above are the kind of patients that I'm getting. And sometimes when they're coming in for makeovers and we'll talk about kind of pros and cons of both materials, more often than not, they're kind of at that stage where they're like, I just want to have it done now, and something that's just not going to have maintenance involved or anything like that. And
Are you dealing with an older demographic? Is that what I'm hearing you say as well? Maybe one
yeah,
of
So
the
he's
last
saying older
right?
farmers.
Yeah.
yeah, I pretty much see, I'd say like last year, 5 people.
Well,
that
is
were,
that challenging for you to be teaching something and saying, guys, here, and then to be applying not as much as you'd like to in your career life,
no, I don't think so.
your
I kind of,
clinical practice? Okay.
yeah, I guess all the previous years, even though you could say it can't be that many because I look 12, it's been kind of very resin heavy. So I've done a lot of resin. It was pretty much just like all resin for a really long period of time. And then I think naturally, a lot of those hand skills and bits like that kind of follow in nicely to indirect stuff as well, and understanding, talking to a technician better because of you've gone through layering and you've seen mistakes and seen those 3D elements of how much tooth space you might need and light and shade and color. And so it was useful to have that as like a base to then go on to do some of the more indirect stuff and ceramic bits and pieces. But now I think it's just kind of a blend, and it's what's going to be right for that patient at that stage in their life, I guess. But
Are you into 3D scanning and things like and digital printing at all?
yeah,
Yeah.
pretty much most ceramic cases that we do will probably go digital. Some of the really minimal veneers, I'll still go kind of analog with that kind of stuff. But
Right.
yeah,
You mean
digital's
you go digital, meaning you 3D scan and then you mill them?
yeah. So I won't mill the restorations myself or in practice. So we haven't got the CEREC or the prime scan, but we're using Itero. I'd like to get a 3 shape, but we're using Itero right now, and I send that off to the technician, and he will. Well, initially I would send him the analog and the digital option. I tell him, pick what's best, and then we found, depending on how much structure I was removing, that most of the time digital was actually kind of going to work really well.